It is National Pancreatic Cancer Awareness Month, and according to a recent study, cases are increasing overall slightly more among women than men. Here to explain what doctors are seeing is Chief of Surgical Oncology, Dr. Charles Cha at St. Vincent's Medical Center Cancer Institute. First of all, thank you for your time this morning.
Well, thank you for having me, Melissa.
Absolutely. Very important to talk about. Let's start with what's behind the increasing numbers for pancreatic cancer, and why does it appear that more women are impacted?
So really, this is a paper that was published just last month in JAMA that discovered that the rates overall of pancreatic cancer are increasing. We used to think it was around 0.5% per year annually increasing, and that's reaching almost 1% for both men and women. But what they found was a little bit alarming was that the rate amongst women, particularly younger women under the age of 50, and really even higher amongst women under the age of 35, was increasing at sometimes a 4-time to 7-time increased rate compared to men. The exact reason for that is not really well delineated. I'm hoping it's more due to early detection, but I think it's probably some environmental factors that we haven't really identified yet.
And you just mentioned early detection. Obviously, that is important if possible. How can early detection impact prognosis for patients?
Well, early detection for pancreatic cancer really is key. If we can catch it early, it's potentially curable and patients can live quite a bit longer. If it's not caught early, patients typically don't do as well, typically about a year or so at most. But unfortunately, the majority of the time, it's not caught early. This is an area of a lot of intensive research, but it's something that we don't have great screening for yet.
Is there a certain age, people should really be starting to think about getting those checkups?
Well, I think any patient at any age who has new onset of diabetes, unexplained weight loss, abdominal pain should see a physician in order to get checked out. Those are things that are quite common and so aren't specific for pancreatic cancer, but can allow us to find tumors at an earlier stage.
Yeah. What are some of the treatments that are available?
Whenever possible, we always try to treat with surgery, so surgical removal of the tumor is always best. If not, then typically chemotherapy or radiation are used, and really the newest trend is to treat with chemotherapy before surgery to try to shrink the tumor, and then to remove the tumors out after the chemotherapy has shrunk the tumor. And there's newer data suggests that those patients who we previously thought were not resectable, where they couldn't get the tumors removed, that we're now able to shrink the tumors and remove them at a higher rate than we thought possible in the past.
Dr. Cha, are there any ways that we can, or anything rather, we could be doing right now to possibly help prevent pancreatic cancer?
Well, it's sort of the usual things for any cancers. There is a higher risk of pancreatic cancer amongst smokers, people who drink. If you're obese, those are all going to increase your risk. So generally we tell patients just to live a healthy, good life, exercise. If you have a high family history, first-degree relatives, or you have some genetic alteration that increases your chance of pancreatic cancer, then you might be somebody who actually needs to be screened regularly for pancreatic cancer, but that's quite rare.
Okay, Dr. Cha, we appreciate your time. A very important conversation this morning. Where can people go for more information?
Well, they can go to hartfordhealthcare.com.org or come to the St. Vincent's website.
Wonderful. Thank you so much for your time. We appreciate it.
Sure. My pleasure. Thank you.
Thank you.